At 73 years old, Margaret had always been the one everyone called when they needed someone to walk their dog, tend their garden, or help with household chores. But last Tuesday morning, something changed that would shake her confidence to its core and reveal a hidden epidemic affecting millions of seniors worldwide. As she stepped out of her front door to collect the morning newspaper, a sharp, burning sensation shot through her left calf like lightning, forcing her to grip the doorframe with white knuckles as her breath caught in her throat. The pain wasn't just uncomfortable, it was terrifying because for the first time in her active life, her body was sending her a message she couldn't ignore, a warning signal that would lead her to discover she was part of a staggering statistic that most people never hear about until it's almost too late. What Margaret didn't know in that moment of searing pain was that she had just experienced the early warning sign of a condition that affects over 20 million Americans, a condition so commonly misunderstood that 75% of people who have it don't even realize they're living with a ticking time bomb in their circulatory system. The pain Margaret felt wasn't just muscle fatigue or the normal aches and pains of aging that everyone told her to expect. It was her body's desperate attempt to communicate that her blood vessels were crying out for help, struggling to deliver the oxygen and nutrients her hardworking leg muscles desperately needed. This phenomenon, known as claudication, is like having a traffic jam in your circulatory highway, where narrowed arteries create bottlenecks that starve your muscles of the fuel they need to function properly. Imagine trying to water a garden through a kinked hose. The water struggles to flow, creating pressure and eventually causing the hose to fail at its weakest point. And that's exactly what's happening inside the bodies of millions of seniors who dismiss leg pain as just another inconvenience of getting older. The cruel irony is that this pain, which many people try to push through or ignore, is actually their body's sophisticated early warning system working exactly as it should, sending urgent messages that could prevent devastating complications if only people knew how to listen. When you experience pain in your legs while walking, particularly that cramping, burning, or aching sensation that forces you to stop and rest, your cardiovascular system is essentially sending you a text message that reads urgent attention required. But most people delete this message without reading it carefully. The pain typically starts in your calves, but can also manifest in your thighs, buttocks, or even your feet, creating a pattern that becomes as predictable as clockwork, appearing after you've walked a certain distance and disappearing when you rest. This isn't random pain, it's not arthritis, and it's not just muscle fatigue. It's a precisely orchestrated biological response to insufficient blood flow, a condition that medical professionals call peripheral artery disease, or PAD, which sounds clinical and distant until you realize it's affecting someone you love, or perhaps even yourself. The most frightening aspect of this condition isn't just the pain itself, but what that pain represents, because peripheral artery disease is often the canary in the coal mine, warning of more serious cardiovascular problems that could be developing silently throughout your body. Research conducted by the American Heart Association reveals that people with PAD are 6 times more likely to die from cardiovascular disease within 10 years compared to those without the condition, a statistic that should make every person experiencing leg pain sit up and take notice. Dr. Sarah Chun, a leading vascular surgeon at Johns Hopkins, explains that the arteries in your legs are like the smaller branches of a tree. If they're showing signs of disease, there's an excellent chance that the larger branches, including the arteries feeding your heart and brain, are also compromised. This connection isn't coincidental, it's systematic because atherosclerosis, the process that causes arteries to narrow and harden, doesn't discriminate between body parts. It's an equal opportunity destroyer that affects your entire circulatory network simultaneously. The plaque buildup that's causing pain in your legs is likely also accumulating in your coronary arteries and carotid arteries, setting the stage for heart attacks and strokes that could occur without any additional warning. Clinical studies spanning over 2 decades have consistently shown that PAD serves as a crystal ball for cardiovascular health, with researchers at the Mayo Clinic documenting that patients with severe leg pain while walking have a 40% chance of experiencing a major cardiovascular event within 5 years if left untreated. These aren't abstract medical statistics. These are real people with real families who thought their leg pain was just part of getting older until they found themselves in emergency rooms fighting for their lives. The progression is often silent and insidious, starting with mild discomfort that you might attribute to overexertion, gradually increasing in intensity and frequency until walking even short distances becomes an ordeal that dramatically impacts your quality of life. What makes this particularly tragic is that early intervention can not only relieve the pain, but also significantly reduce the risk of heart attack, stroke, and even death. Yet most people wait until the condition has progressed to dangerous levels before seeking help. The mechanism behind this pain is both fascinating and terrifying when you understand how your circulatory system is supposed to function optimally. Your leg muscles are powerhouses that require enormous amounts of oxygen and nutrients, especially during physical activity. And when healthy arteries can't deliver adequate blood supply, these muscles begin to suffocate at the cellular level. The pain you feel is actually lactic acid and other metabolic waste products building up in oxygen-starved muscle tissue, creating a biochemical SOS signal that your nervous system translates into the unmistakable sensation of cramping, burning, or aching. This process is so reliable that vascular specialists can often predict the severity of arterial blockage based solely on how far a patient can walk before pain forces them to stop. A person who experiences pain after walking 2 blocks has less severe blockage than someone who can't make it to their mailbox without stopping, creating a cruel measuring stick that charts the progression of a potentially life-threatening condition. The most insidious aspect of peripheral artery disease is how it tricks people into a dangerous cycle of activity avoidance that actually accelerates the progression of the underlying condition. When walking hurts, the natural response is to walk less. But decreased activity leads to muscle deconditioning, weight gain, and further deterioration of cardiovascular health, creating a downward spiral that becomes increasingly difficult to escape. Margaret discovered this firsthand when she began taking the car to places she used to walk to, telling herself she was just being practical, but within 6 months she noticed that even shorter distances caused pain, and her overall energy levels plummeted. The human body operates on a use it or lose it principle, and when you stop challenging your circulatory system, it responds by becoming even less efficient, narrowing the already compromised pathways and reducing your functional capacity even further. What makes this particularly cruel is that many healthcare providers, even well-meaning ones, sometimes dismiss leg pain in elderly patients as a normal part of aging, inadvertently contributing to delayed diagnosis and treatment. A groundbreaking study published in the Journal of the American Medical Association found that it takes an average of 18 months from the onset of symptoms for patients to receive a proper diagnosis of PAD, during which time the condition often progresses significantly. This delay isn't just inconvenient, it's dangerous because early-stage PAD responds much better to treatment than advanced cases, and the window of opportunity for preventing serious complications gradually closes with each passing month of untreated arterial disease. The tragedy is that simple, non-invasive tests can detect PAD in minutes. Yet millions of people continue to suffer needlessly because they don't realize their pain is a medical emergency in slow motion. The good news, and this is where hope enters the picture, is that your body possesses a remarkable ability to adapt and heal when given the right support and treatment. Even arteries that have been narrowed by years of plaque buildup can be reopened through various medical interventions, and in many cases, the body can even create new pathways around blocked arteries through a process called collateral circulation. Dr. Michael Rodriguez, a cardiovascular specialist who has treated thousands of PAD patients, describes the circulatory system as having an almost magical ability to reroute blood flow when main highways become blocked, developing side streets and alternate routes that can restore adequate circulation to starved tissues. This biological flexibility means that even people with advanced PAD can experience dramatic improvements in their symptoms and overall health when they receive appropriate treatment and commit to lifestyle modifications that support vascular health. The foundation of PAD treatment begins with understanding that this condition responds incredibly well to a multi-pronged approach that addresses both the immediate symptoms and the underlying causes of arterial disease. Walking therapy, which might seem counterintuitive when walking causes pain, has been proven in countless clinical trials to be one of the most effective treatments available, literally training your body to develop new blood vessel pathways while improving the efficiency of existing circulation. The protocol involves structured walking programs where patients gradually increase their walking distance, pushing through mild discomfort under medical supervision, which triggers the body's natural healing mechanisms to create new vascular networks. Studies show that patients who complete supervised walking programs typically experience a 3 to 4-fold increase in their pain-free walking distance within just 12 weeks, transforming from people who struggle to walk across a parking lot into individuals who can comfortably walk several blocks without distress. Medication management plays a crucial role in comprehensive pad treatment, with several categories of drugs working together to improve blood flow, reduce clotting risk, and protect existing arteries from further damage. Antiplatelet medications like aspirin or clopidogrel help prevent blood clots from forming in narrowed arteries, while medications like cilostazol can actually improve blood flow and reduce symptoms significantly. Cholesterol-lowering statins serve a dual purpose, not only reducing future plaque formation, but also stabilizing existing plaques to prevent them from rupturing and causing complete arterial blockage. Blood pressure medications ensure that the pressure in your circulatory system doesn't further damage already vulnerable artery walls, creating an environment where healing can occur. The key is understanding that these medications work synergistically, each one addressing a different aspect of the complex problem, and patients who commit to their medication regimens typically see dramatic improvements in both symptoms and long-term outcomes. For people with more severe blockages, minimally invasive procedures can literally open up new possibilities for comfortable, pain-free movement. Angioplasty, where a tiny balloon is inflated inside a blocked artery to push plaque against the artery walls, can restore blood flow in minutes, often providing immediate relief from claudication symptoms. In some cases, stents, which are tiny mesh tubes, are placed in the artery to keep it open permanently, creating a reliable pathway for blood flow that can last for years or even decades. More advanced cases might require bypass surgery, where surgeons create new routes around blocked arteries using either synthetic grafts or blood vessels taken from other parts of the patient's body. While these procedures might sound intimidating, they're performed routinely with excellent success rates, and many patients describe the difference as life-changing, suddenly being able to walk distances they hadn't managed in years. The lifestyle modifications that support pad treatment extend far beyond just walking programs, encompassing a comprehensive approach to cardiovascular health that can literally reverse years of arterial damage. Smoking cessation is absolutely critical, as tobacco use causes immediate constriction of blood vessels and accelerates plaque formation, essentially pouring gasoline on the fire of arterial disease. Within just 24 hours of quitting smoking, circulation begins to improve, and within 1 year, the risk of heart disease is cut in half, demonstrating the immediate benefits of this crucial lifestyle change. Dietary modifications focused on reducing inflammation and supporting vascular health can significantly slow or even reverse the progression of atherosclerosis. A Mediterranean-style diet rich in omega-3 fatty acids, antioxidants, and anti-inflammatory compounds provides the building blocks your body needs to repair damaged arteries while preventing further deterioration. Weight management plays a particularly important role in pad treatment because excess weight puts additional strain on an already compromised circulatory system, while contributing to diabetes, high blood pressure, and inflammation that accelerate arterial disease. Even modest weight loss of 10 to 15 pounds can result in noticeable improvements in walking tolerance and overall cardiovascular health. The beautiful thing about weight loss in pad patients is that it creates a positive feedback loop, as improved circulation makes physical activity easier and more enjoyable, which in turn supports further weight loss and continued improvement in symptoms. Stress management techniques like meditation, deep breathing exercises, and gentle yoga can help reduce cortisol levels and inflammation that contribute to arterial damage, while also improving overall quality of life during the treatment process. Consider the transformation of Robert, a 68-year-old retired teacher who came to his doctor's office barely able to walk from the parking lot to the building without stopping to rest. His wife had been begging him to seek help for months as she watched him gradually limit his activities, declining social invitations and avoiding family gatherings because he was embarrassed about his walking limitations. Robert's ankle brachial index, a simple test that compares blood pressure in the arms and legs, revealed severe PAD, with blockages reducing blood flow to his legs by more than 60%. His cardiologist immediately started him on a comprehensive treatment plan, including medications to improve blood flow and prevent clots, a supervised walking program 3 times per week, and dietary counseling to address his underlying cardiovascular risk factors. Within 6 weeks, Robert noticed he could walk further without pain, and by 3 months, he was not only walking comfortably around his neighborhood, but had rejoined his weekly golf group and was planning a vacation that would involve walking tours of historic cities. The psychological impact of successful PAD treatment extends far beyond just physical improvements, restoring confidence, independence, and quality of life that many patients thought they had lost forever. Sarah, a 71-year-old grandmother, had gradually stopped playing with her grandchildren and attending their sporting events because walking from parking areas to bleachers had become too painful and exhausting. After undergoing angioplasty to open blocked arteries in both legs and committing to a walking rehabilitation program, she described feeling like she had gotten her life back, attending every one of her grandson's baseball games that season and even taking her granddaughter on shopping trips to the mall that would have been impossible just months earlier. These stories aren't exceptional. They're typical of what happens when PAD is properly diagnosed and treated, yet millions of people continue to suffer needlessly because they don't realize help is available. The ripple effects of untreated PAD extend throughout families and communities as active, independent seniors gradually become homebound and socially isolated, requiring increasing levels of assistance from family members and healthcare systems. When Margaret finally received proper treatment for her PAD, her daughter, Jennifer, realized how much stress she had been carrying, constantly worrying about her mother's declining mobility and independence. Jennifer had been secretly researching assisted living facilities and making contingency plans for her mother's care, never realizing that her mother's problems were completely treatable. After Margaret's successful treatment, Jennifer described feeling like she had gotten her mother back, watching her return to the active, engaged person she had always been, tending her garden, volunteering at the local library, and maintaining her independence well into her 70s. The economic implications of untreated PAD are staggering when you consider the cascade of complications and healthcare utilization that result from this preventable and treatable condition. Patients with untreated PAD are significantly more likely to require emergency room visits, hospitalizations, and expensive interventions for heart attacks, strokes, and advanced arterial disease. A comprehensive analysis by health economists found that every dollar spent on early PAD detection and treatment saves approximately $8 in downstream healthcare costs, not to mention the immeasurable personal and family costs of disability, loss of independence, and premature death. Insurance companies are beginning to recognize this economic reality, with many plans now covering comprehensive PAD screening and treatment programs that would have been considered optional just a few years ago. The technology available for PAD diagnosis and treatment continues to advance at a remarkable pace, offering hope for even better outcomes in the future. New imaging techniques can create detailed maps of arterial blockages without invasive procedures, allowing doctors to plan treatments with unprecedented precision. Drug-eluting stents that slowly release medications to prevent reblockage are showing excellent long-term results, while new medications are being developed to actually stimulate the growth of new blood vessels around blocked arteries. Researchers are even exploring stem cell therapies that could potentially regenerate damaged arterial tissue, though these treatments are still in experimental phases. The key message that every person experiencing leg pain while walking needs to understand is that this isn't just a minor inconvenience or inevitable part of aging. It's a serious medical condition that requires prompt attention and comprehensive treatment. The pain you're experiencing is your body's way of telling you that your circulatory system needs help, and ignoring this message could lead to devastating complications that are entirely preventable with proper care. The good news is that PAD is not only treatable, but responds remarkably well to intervention, with most patients experiencing significant improvements in their symptoms and quality of life when they commit to comprehensive treatment plans. If you're experiencing leg pain while walking, cramping that forces you to stop and rest, or any reduction in your walking ability that you've been attributing to normal aging, you owe it to yourself and your family to seek medical evaluation immediately. The simple ankle brachial index test takes just minutes and can provide crucial information about your circulatory health, while additional tests like ultrasound or CT angiography can create detailed pictures of your arterial system to guide treatment decisions. Don't let embarrassment, fear, or the assumption that leg pain is just part of getting older prevent you from getting the help you need and deserve. Your body has been trying to tell you something important, and now you have the knowledge to understand what that message means and what you can do about it. The difference between a life limited by pain and disability and one filled with comfortable movement and independence often comes down to recognizing the warning signs and taking action while treatment can still make a profound difference. Every step you take toward addressing leg pain while walking is a step toward a future where you can move comfortably, maintain your independence, and enjoy all the activities that make life worth living, surrounded by the people you love and engaged in the world around you.